how about let's talk about why foot care is important. And I mean, we know those relationships, and it just gives one more person to join somebody's care team and advocate for them and be there for them. But why is foot care so important in
Sure.
seniors?
Yeah, of course. I mean, there's so many reasons why foot care is important. Vascular neuropathies, the ability to stay mobile and independent, the fact that the foot is the furthest from the heart and the first place that we're going to see signs and symptoms of changes in the system. Medications often affect the condition of the foot as well, and as you age, you do end up, hopefully not, but most people do end up taking several different medications. And we see those aligning in, whether they're going to end up with edema or water retention, whether they're going to end up with neuropathies or circulatory issues affecting the nerve pathways. So there are so many different diseases that can happen as we age that we see in the lower limb. For example, if somebody is having some cardiac or so some heart issues or some lung issues or kidney issues as they age, which could be related to diabetes, it could be related to medication, it could be related to diet. Regardless of the foundation for why that event is happening, we will see those changes in the foot. There's going to be changes to the nail condition, to the color of the nail, texture of the nail. There might be some changes in the tissues or the skin. We might see some shadowing or some edema starting. And those are the things that the nurses, when they're in there, are trained to recognize, trained to be able to identify, the assessment of where this issue might be coming from, and then make the proper referrals. So we may be referring to the physician and saying, we'd like to see an ultrasound. And the nurses are wonderful to know which care pathway we want to follow in order to make sure that whatever it is that we've seen can then be addressed in an efficient manner. But we're first line there looking at the legs. And when I'm teaching, I teach my nurses, you will probably be the first one to diagnose a cancer. As nurses
Really?
don't do diagnoses, but you will be the first one to find it and identify it and send it to the physician for diagnoses, because we're the ones looking at that lower limb.